Simeon Brown is in the news twice today.
Oh, that lovable little scamp.
Yeah, that little guy. Um, Number
Politician
one,
most voted to look like a chuppa chup.
um, he, well, I suppose because he's the Minister of Health. They have hang on, what am I trying to say? Defunded, I suppose technically somewhat defunded, a Māori health initiative to screen Māori and Pacifica for bowel cancer from age 50. Currently, it is 60 and up. You get free bowel cancer screenings between the ages of 60 and 74. There was a pilot program running for Māori and Pacifica where they dropped that screening down to 50. And because Māori and Pacifica are at higher risk of getting bowel cancer much earlier in their late adulthood. However, they've pulled the funding in the name of equality. And so they decided to reallocate that funding to drop the age of free screening from 60 and to start it at 58 for everyone instead, which is not a bad thing. I mean, it's an extra 2 years that it's going there, but something that they mentioned was that it's now going to where it's most needed. They decided to change it based on need, despite the fact that I would argue that many experts now argue Māori and Pacifica people need it a little bit earlier because their stats show that they get it earlier. So the whole idea of putting it where it's needed by dropping the age by 2 years for everyone, perhaps not the best use of that funding. However, anyone that was in that pilot program will continue to access that free screening from age 50. So they'll continue to get it for the next 10 years. But I don't imagine there was too many people that were in that program. And the age for people in Australia, they do their bowel screening for everyone from the age 45 and up. Which I mean would be a much better initiative altogether. If you wanted equality, you could have dropped it all down to 50, but that is what it is. There are some experts that have called this essentially institutionalized racism. Essentially not giving Māori and Pacifica what they need. The health outcomes that it will cause, or the poor outcomes that it will cause for Māori and Pacifica, who we know tend to have poorer outcomes than that of other populations here in New Zealand. And something I realised was that other than getting it earlier, for whatever reasons, Māori and Pacifica people, not to generalise, but there's a good large portion of them that are in lower socioeconomic situations and will probably put off going to the doctor if they have health issues in favour of other things. So that could be part of why their stats are quite poor when it comes to bowel cancer. And how when they catch it, it might be quite far down the line. So really, this is pretty shit. The other populations, higher socioeconomic people in better circumstances, will not put off going to the doctor. They will probably have better access to healthcare. And if they start to see issues, they probably will go to the doctor pretty soon after those issues start to arise. And probably will also be believed is another thing as well. When they have issues, there's a lot of stats out there. Well, there's a lot of research out there that says that ethnic communities or minority communities tend to be dismissed a lot more often than I guess Caucasian communities, really. Yeah. So yeah, it's a pretty shit day, I think, for Māori, and I'm all for everyone getting better healthcare in terms of better screening and things, but I would have said that this was much more needed for them than it is for the large majority of the population. Or even better still, they could have just dropped everyone down to 50.
Yeah. I think this is going to become a theme for the rest of the show. Simi Brown has acted against all advice. Years and years of study and data pointed people in a particular direction, and they said a portion of our population is affected by this more, has worse outcomes in our health system. We have problems with systemic racism, and we should do something about that. We can do something about it because we've looked at it, we've done the work, we've found out that it is actually a fucking thing. And we've found out that that portion of our population is affected by this at an earlier age and has worse outcomes when they get it. So we don't have infinite money. We can't just drop it down for everybody. So why don't we just drop it down for the affected group? But people see that as, why do they get the fucking bowel screening and I don't? You know, it's they see it as a race issue, and to solve it, they did a racism. It's ideal. Like, one of my big issues with Simeon Brown, more than anybody in National, he is an ideologue. He is someone that is quite happy to play the culture war things. If you follow his social media, see how snippy and snarky he is towards the Greens about various issues. Like, everything he's done in this government has been ideologically driven and 100% against expert advice. Raising the speed limits, against expert advice. Cancelling pedestrian safety measures and I see a kitty tail. You know, all of these things that we're improving things for pedestrians and cyclists, and you know, making people safer. God, get them out of there. Unlock the true potential of the country by mildly increasing the speed limit to a level where people will definitely not survive as often. And then he's put in health, and then exactly the same thing happens. That he starts making edicts based on a vibe and really playing into that culture war thing, rather than doing the work and going, there's been a shit ton of data, and I can actually look at the data and I can understand what needs to happen. He hasn't looked at any of that. Guarantee it. Has been in the job long enough.